Last week in Maryland, David Bennett Sr., the 57-year-old who was transplanted with a genetically modified pig's heart, died. As I said earlier, for me it brought back memories of baby Faye in the mid-1980s. She was a newborn in California with a potentially catastrophic heart abnormality called hypoplastic left heart syndrome, and she was given a baboon heart transplant. Baby Faye survived 21 days after the operation, and the surgeon, Dr. Leonard Bailey of Loma Linda Medical Center, was kept away from the media storm which followed. I was the first person, actually, to get an interview with Dr. Bailey, and I thought I'd rerun that interview from 1985, the first year of the Health Report. Dr. Bailey made an explosive admission during the interview which got worldwide coverage after I ran it. Here's part of that interview.
As you know, the original heart transplant in man was a cross-species transplant. It was done at the University of Mississippi by Jim Hardy in 1963, I think. And then with a brain death code that came into existence in this country, we were able to get cadaveric organs from humans. And the cross-species notion got set aside, except for research.
What species was used in that first...
That was a chimpanzee.
If you look at the results that were got in Mississippi and then later in those early days of heart transplantation, were they much different?
Well, I think they were considerably different. One is the techniques of just doing heart transplantation were new in those days. And the key thing about the Mississippi experience is that that heart didn't reject at all. The patient died, but not because the heart rejected. So in that sense, it showed some promise, but got a lot of criticism. And so the bulk of the research in cross-species transplantation has been kept in the laboratory setting since then.
What is the evidence there for the newborn baby being more tolerant immunologically?
Well, just in general, the baby's immune system is all geared up for tolerance because it's just come out of a hostile environment of the uterus, and it's trying not to reject the uterus and the mom and everything else, and vice versa.
Is the concept something like you've got to get in before the gates close, and once the gates close, you're okay?
The question is when the gates close, and clearly in humans, the gates close in utero.
Presumably then, in the newborn period, it's too late.
Only in a speculative sense.
The reason for wanting to look at cross-species in the newborn period is the lack of donors. Is that a real problem?
It is indeed. Pediatric neurologists have a very difficult time knowing for certain that a newborn is brain dead. The second is, if a baby is clearly brain dead, they're a baby that's had cardiopulmonary resuscitation already and is not a suitable candidate for an organ transfer.
Why did you choose baboons?
That's a good question. There are perhaps other subhuman primates that would be genetically or immunologically closer than a baboon. And artificial insemination in chimpanzees has been generally unproductive, whereas baboons readily procreate, and so that there's a vast number of infant baboons that we can draw from.
If we leave medicine and go to evolution now, what's the extent of the genetic differences between baboons and humans?
You're talking to a fundamentalist in a sense, and my concepts of evolution deal more with a microevolution or variation within species, and I don't have a keen understanding of the differences.
When you say fundamentalist, you mean what?
Perhaps all of us having been created more or less at the same time, including the subhuman primates. But I think there have been variations within species and so forth since then. I think that's consistent with my belief in fundamental creationism, that sort of thing. The scientists that are keen on the evolutionary concept that we actually developed serially from subhuman primates to humans with mitochondrial DNA dating and that sort of thing, the differences have to do with millions of years. That boggles my mind somehow. I don't understand it well. And I'm not sure that it means a great deal in terms of tissue homology.
In a sense, you're saying, well, look, here we have a heart that's physically very similar to a human heart. It's a little bit different, but perhaps not too much different from another human being, so we'll put it in.
Anatomically, it's identical. We have a panel of infant baboons. In fact, our panel is 12 such infant baboons that are all pre-screened already. And so we can then type a recipient and then go select out of that 12 those that most closely match in terms of HLA typing or tissue typing.
I know you're not allowed to talk too much about, because you're not yet published your data about the experience with baby Faye, but can you say why baby Faye died? I mean, was it a rejection problem? Can you say it in broad terms like that?
I think it's reasonable to say, and it's already known, that she didn't die of an ordinary classical rejection. And we're still investigating the interesting phenomenon around her death. I wish I could discuss it with you, but I can't.
And just finally, you've already commented on your deep religious beliefs. Do you believe that there is an ethical issue to be discussed in surgery such as this?
I think the key ethical issue that we tried to address was whether or not it was reasonable or ethical to perform this kind of an operation on an individual who is incompetent to give his own consent or her own consent. The only way that becomes ethical is if there's a therapeutic imperative involved. And we felt that we had enough information at the time of the clinical trial to suggest that there was indeed clear therapeutic intent for this child. In that case, then it's entirely up to her parents to make the decision.
And Leonard Bailey never did another cross-species transplant, although he had many baboons on the side, but he did do many human ones. And interestingly, a survey of Australian medical students at that time showed that about 20 or 30% of them did not believe in evolution either.